quality assurance process is these days a part of any anesthesia department, and it's also in our department, and it's not the aim. And these are just to satisfy our patients and optimize the post-operative analgesia and not to increase the risks. Actually, we are developing the post-operative analgesia since years, and therefore we developed some indicators to improve the outcome and minimize the side effects of our post-operative analgesia. And the telemedicine concept itself will allow us to really analyze the indicators which we have put in real life and to adjust the requirements of the post-operative analgesia as required in real time.
Dr. Shaji, this is file of Mr. Hassan.
Okay.
OT3.
Okay. Hello, sir. Yeah, I know this patient. This is a 51-year-old male patient with a right elbow fracture. We'll be inserting a supraclavicular plexus catheter for the surgery and for post-op pain management and physiotherapy.
We have the evidence now that regional analgesia by peripheral nerve catheter is much more better than by opioid IV. Our problem actually is that it is impossible to know the exact location of the catheter. It can be inside the nerve, extremely close to the nerve, or half centimeter from the nerve. Some surgeries are extremely painful the first 24 hours, but then the pain will decrease, not on a linear function.
You saw me inserting the supraclavicular catheter just now, and as soon as I perform the procedure, I'm going to enter the patient on the website so that the local anesthetic regime and the protocol is well documented. And as soon as we shift the patient to the recovery, the nurse is going to have the details of the patient, and so she can connect the patient to the pump as soon as possible. So you have a patient who will be pain-free, and everything is documented on the website.
We are now connecting the telemedicine pump to the patient. So the settings has been done earlier, and now we will just check the identity of the patient. Are you Mr. Osama?
Yes, sister.
So now we are ready to connect the patient.
So we need to adapt the local anesthetic regimen infusion to the real need to the patient, to prevent any pain and to prevent any excessive numbness or any motor blockade. For that, we need to have the feedback from the patient. And with this telemedicine pump, it is possible to have this feedback in live with alerts on excessive value. For example, on the pain score, if I have a pain score of over 60, I will receive an SMS directly on my smartphone, and I will be able to act immediately, connecting to the website and changing the setting of the pump by remote control. So this interactivity in life with the pump will probably allow us to reach the perfect analgesia that we call the functional analgesia.
Honey, you remember this patient Hussam we do yesterday for pelvic surgery?
Yes, with supraclavicular block.
Yes. In the morning during round, the physiotherapy asking to avoid any motor blockade during physiotherapy. So at this time I decrease the base rate from 5 ml per hour to 3 ml per hour.
Is there any motor block?
No motor blockade at all.
So my advice now, return back to 5 ml per hour and we'll put on the pump and we'll see within the next 3 hours.
This concept of pain management by telemedicine is very trendy. Trendy because paperless, of course. Trendy because it will increase the security, the safety in anesthesia, and trendy because it is in a process of assurance quality. So I hope that we will develop more and more this concept in the future.